Well, let's get more now on another of our top stories this evening and the continuing conflict in Sudan. Sky News has seen evidence of mass graves in the western city of Al Janaina. Civil war broke out in the country 4 months ago. Now volunteers have told us that bodies have been lining the street. Well, let's speak to Deepmala Mahla, the Vice President for Humanitarian Affairs at the not-for-profit organisation CARE. Deepmala, thank you very much for taking the time to speak to us this evening. You will have seen the reporting, and I presume you're not surprised by what has been revealed.
I mean, absolutely, very unfortunately, not surprised at all. This has been brewing since mid-April, and I must highlight when the fighting broke out in middle of April, even before that, Sudan was a very serious humanitarian crisis when 1 in every 3 people was in need of humanitarian assistance. And yes, the way things are unfolding, it is hugely concerning. And you've mentioned about bodies. Well, it is not only about the bodies, the people who need treatment, the wounded, because as we know, only 16% of the health facilities in Khartoum are functional. Well, CARE has been delivering services, but it's increasingly challenging because of the uncertainty, supply chain, and insecurity.
And as we pointed out, this conflict has been going on now for 4 months. As the world's attention moved away from it, you know, once we stop seeing on our television screens all the time the fighting around the capital, and it moves back to areas that perhaps we're over familiar with, like the fighting around Darfur, has the attention gone away?
Definitely, Kamali. First of all, the humanitarian crisis in Sudan never had the level of attention that it should have had, given how many people were at risk. We are talking of a country where 3 million children who are not even 5 years old are acutely malnourished. And yes, we did get some headlines in April and May, but the fact of the matter is, when the headlines fade, it does not mean that the needs of the communities have faded. So yes, we are suffering from a lack of attention, which also means that we are also suffering in terms of inadequate funding.
Yeah, and the UN are reporting a figure which is astounding: 15.8 million people, a third of the population, needing humanitarian assistance. I mean, the level of need in Sudan is vast.
Absolutely. And the number of people which you have mentioned, the situation which they will be facing of acute hunger, that will be during the harvesting season. Those were usually the better months. And more people, so many people going hungry during the harvesting season is a very sad state. And there are several reasons behind it. The key ones being people were not able to sow, people were not able to prepare for the harvesting season. And once that is missed, we know that people do not have enough to eat. And also what is happening is there is so much information which we have from our teams about looting of grocery stores, pharmacies, fuel stations, and all this is really discouraging the businesses to reopen, which means that the commodities are not available, or if they are available, the prices are extremely high. And it looks very dire, very dire. And the most important thing is there have to be safe passages for humanitarians to be able to deliver aid, for civilians to be able to come and get the service that they require. And that promise of protecting civilians, civilian infrastructure, and humanitarians has been broken far too many times.
I mean, what pressure is it putting on neighbouring countries as well? Our correspondent Yusra was on the border with Chad, and she sort of revealed to us what is the beginning of a refugee camp there. How equipped are those neighbouring nations to be able to help with the influx of refugees that they're seeing?
That is really a grave situation. And then, yes, hundreds of thousands have crossed into Chad. We initially saw a number of, if I recall correctly, some 50 to 60,000 who had crossed the border within the first week, 10 days. And now we are talking of more than 300,000 people. And when people flee, or when people are forced to flee, they often are not able to take with themselves anything. And we have heard it far too many times, people saying, women saying that if they are able to take their children with them, they consider themselves to be lucky. And yes, there are settlements, people are settling in, the situation is dire. Again, the immediate needs. What we understand from our communities, our staff who have been on the ground, CARE has been providing assistance from the first week. Sanitation, food, water are huge needs. And of course, the protection for women and girls is another crisis. So the crisis of Sudan is affecting the neighboring countries as well, and it is already stretching the stretched infrastructure.
Okay. Deepmala Mahla, we'll leave it there. Thank you very much for your time, and wish you all the best with your work. Thank you for being with us.
Thanks for having me, Kamali.